Today, here to discuss the importance of dental hygiene and its lasting effect, she is our very own Charmaine Davis from St. Kitts and Nevis, now living and working in Brooklyn, New York. She is no stranger to the media, as she has been featured on CNN and was recently named one of the top 25 women in dentistry. Charmaine, good morning and welcome to Good Morning SKN. It's our pleasure having you on this morning.
Morning, Charmaine.
Good morning. It's a pleasure being here with you guys this morning. Thank you guys for having me.
You are certainly welcome. So let's begin with your journey to becoming a dental hygienist. How did you get to where you are today?
Well, interestingly enough, when I was a child in elementary school in St. Kitts, we had a missionary trip from the U.S. And I remembered admiring this, what we call now a dental nurse. And I remember telling her I was on my way to the U.S. This was in 1985 when we were coming here. And told her I wanted to be just like her. 30-something odd years later, I'm in the same position she is. And I'm grateful for that opportunity.
That's sweet. So did you falter anywhere along your journey to becoming a dental hygienist? Were there days when you'd be like, this is just not for me?
Oh, most definitely. I was originally a student for dental assisting at New York University College of Dentistry. That was very challenging because I was a single mom and my son was about 4 years old at the time. But I struggled, but hey, sometimes you have to stand firm to what your beliefs and what your goals are. And I stood firm to it. I had hurdles where I was in the room and I looked nothing like anyone else in the room. Different circumstances would allow me to move forward, but I decided that this was going to be my profession. And because of that, I stood firm to what my goals were.
Oh, congratulations on sticking with
Thank
it.
you.
You're welcome.
So, Charmaine, you are the CEO behind Wings of a Dove Foundation. Tell us a bit more about this.
Well, Wings of a Dove Foundation was founded in memory of my mom, Florence Davis. About 10 and a half years ago, my mom called me, one of the most devastating calls as a child and as a dental professional. She told me she was drinking soup and she couldn't swallow. Right away, I knew something was definitely wrong. As a dental professional, we know what that sounds like. Turns out, after going through many doctor's appointments, doing many tests, she was diagnosed with stage 3 squamous cell, what you call squamous cell carcinoma of the head and neck and the esophagus. And she was given 3 months to live. But because of the grace of God, she lived 22 months. So I was able to do things with her. After she passed, I started Wings of a Dove Foundation because one of the things that she wasn't able to see when I was a kid in St. Kitts, I was a track star, as most people would say. She never saw me run any races. But I remembered in her last days, she said to me, I'm giving you this baton. You must finish my race. And I started this foundation in memory of her. So I would go around to the community. I joined organizations, the Oral Cancer Foundation. I became ambassadors. And I literally went out and spoke to anyone who would listen to me and say, it's important to have your oral examination checked. You should visit your dentist at least twice a year. It's important to have oral cancer screening. It's so very vital to us as in the oral cavity, as well as in the overall health to reach optimal health in our system. So this is in memory of her. And due to COVID, unfortunately, we haven't done anything in the last 3 years. So we'll see what happens for next year.
Thank you for sharing that. That's a beautiful way to keep your mother's memory alive.
Indeed.
Definitely.
Continued sympathies here from Good Morning SKN. So you speak about oral cancer. How does oral cancer and dental hygiene, I want to say correlate, or are they related to each other in some form?
Yes, oral health disease often refers to as a silent epidemic that is affecting our most vulnerable citizens, right? So most people don't realize the correlation between dental health and medical health. Unfortunately, we in the dental professions, we try to educate our patients in the community that there is a correlation. Many diseases in the body, which are chronic diseases, tend to manifest itself in the oral cavity. And most of them, usually we will see them firsthand as dental hygienists. So our role, even though it's mid-level in the dental community, we can actually help save lives. And I notice I said help. We do not diagnose. So we definitely can catch these abnormalities, as we would call them, firsthand and take care of them sooner rather than later.
Of course. And I think to your point, getting people on board and educated about oral hygiene is so important. So for you on your end, what are some of the challenges that you face with getting people educated? And then on the other hand, how do you help sort of bring fun to that awareness and getting people into oral hygiene education?
Well, my experience on education patient is oral health is making sure that patients are well informed of the importance of the oral health cavity. This can help curb fear and anxiety and other barriers they may face. And as stated before, oral health diseases are often referred to as a silent epidemic that is affecting most vulnerable citizens, children from families with low incomes, children from racial and ethnic minority groups, and children with special healthcare needs. It is not unusual to learn of children who are suffering from pain or untreated oral infections and decay. Some of the barriers that they face are financial hardship, and as I said before, fear, geographic location, lack of insurance, poor oral health literacy, language, education, which is my number one priority, or cultural barriers. We go into the community and we educate the community. My focus is usually on the children because most of us, as we know, once we get older, we stay firm in our ways and we don't change our habits. So educating the children plays a bigger role, because if I say to one child, you should brush twice a day for 2 minutes, you should floss once a day, they may go home and educate their parents, their grandparents, and that behavior just might change. So that's where my focus is really.
You are the founder and now the ambassador of Give a Child a Smile. And I know you just spoke along those lines. How important is it that kids smile? How does it boost their self-esteem?
Well, I'm not the founder. I'm one of the ambassadors of the Give Kids a Smile program. It's a huge organization here. The American Dental Association houses this, and they're the ones who are in charge of the licensing. And we have a side program called the Give Kids a Smile. We normally go around the country, and the first Friday in February, we recognize that because we realize there are a lot of cavities in a lot of children's teeth, and they are caused by breakdown on the tooth enamel by acids produced by bacteria located in plaque that collects on teeth. We have to make sure that we educate the population, the people who are underrepresented, the ones who are unemployed, parents who can't get to these locations to make sure that their children are taken care of properly. So we do this once a year. It's something that I'm really excited about. I've been doing for the past 9-10 years, and it's something that I continue to look forward to doing, because this allows me to reach a broader area in communities where we don't normally would actually frequent.
Nice. Keep up the good work.
Oh, thank you so much.
You're welcome.
So Charmaine, I really admire your passion towards education.
Oh, wow.
And, I know you've been featured on CNN. Tell us a little bit more about that experience.
Well, that's an interesting situation. My CNN interview was a precursor for something that I wasn't aware of. I was new to the office that I was working in, and I had a patient. I remembered exactly like it was yesterday. I had a 10 a.m. patient, and he walked in, introduced myself as normal. And I went through taking the x-rays, doing my comprehensive examination, periodontal probing, making sure that all of my procedure work and that all of my materials are set up. Continue with the cleaning, went over oral hygiene, and brought the dentist in to do the exam. At the end of the appointment, this gentleman said to me, he says, "I love what you do. I've been to many dental offices previously, and no hygienists have educated me or shared all of these information that you have." He said, I work for CNN. We would love to interview. We've been looking to feature dental hygienists for the past 6 months and have not been able to find one who can actually fill into the void of what we're looking for, and you fit that criteria. And he said, would you be interested? And within 24 hours, I was I was all over the internet pretty much, and that was my highlight. That was definitely my highlight. So I was able to educate on that video. But one of the most important things that most people asked me about in that video, even though I was featured on that big area of television, at the end of that video, I had a light that I shined into the patient's mouth, and that is called what you call a Velscope. A Velscope is an instrument that we use that will allow us to see any abnormalities in the mouth that can possibly be cancer. And that's one of the most important things that I use when I do a comprehensive exam or oral cancer screening on all of my adult patients. That is so important. It is so vital for us to understand how important it is to do an oral cancer screening and to do a comprehensive exam every time we see a patient, whether it's a 3-month recall visit for maintenance or a 6-month visit for a routine checkup. It's very important that we stress how important that is.